So it's a very interesting case. Good. Someone has already started typing the diagnosis. All right, so this patient is having multiple tiny lucencies within the lung parenchyma, right? The first thing, when you look at tiny lucencies in the lung parenchyma, the first thing to make sure is whether it is emphysema or not. Always remember, emphysema is more common than cystic lung disease. Okay, as we just scroll up further, within these cystic spaces, we have to make sure, let me zoom it out. That's a zoom option. Okay. Are you guys able to see any central vessel sign here? There is not. All the blood vessels are along the periphery of the tiny lucency. That itself implies that this is not an emphysema. So once you ascertain that this is not emphysema, the next thing you have to look at is how is the morphology of the cyst? Are all the cysts uniform in size and shape? Are all the cysts evenly distributed everywhere? Are there any predominance of the location of the cyst? In this patient, the cysts are uniform in size and shape, and all of them are distributed throughout the lung parenchyma. There is no upper-low predominance. There is no lower-low predominance. It's everywhere. Considering this, lymphangial leiomyomatosis is the topmost differential diagnosis. Why it is not LCH, pulmonary Langerhans cell histiocytosis. LCH is like, LCH, how it seeds is the Langerhans cell just goes and lodges within the lung parenchyma, and then it will cavitate, and then it will, what will happen? And then it will become a cystic lesion. So you get to see nodules, cysts, and cavities of varying sizes and shape. Whereas in LAM, it will be uniform, whereas in LCH, which will be asymmetrical, and it will spare the costophrenic angles on the lung basis. And LCH will have some predominant involvement in the middle lobe and lingula, which we don't know why it is involving. The other cystic lung disease you need to be aware of is Birdhawk-Dubé. When you look at a Birdhawk-Dubé, the cyst will always be in the paramediastinal region. Large cyst within the paramediastinal region is, you should always think about it. The other important cystic lung disease is LIP. What LIP will have is large perivascular cyst. So this patient, you're having uniform symmetrical cyst distributed throughout the lung parenchyma, lymphangial leiomyomatosis. The next thing you need to do is take a CT abdomen or ultrasound abdomen to look for any evidence of angiomyolipomas to correlate with whether there is any tuberous sclerosis. If you see angiomyolipoma, the next thing is to screen the brain. If you screen that, kindly do a screening of cardiac MR also to rule out rhabdomyomas sitting in the heart. So you have to go one notch up. You have to give recommend CT abdomen and MR brain to look for any abnormalities.